everyone, today we'll be presenting diphtheria. Diphtheria is an acute toxin-mediated infectious disease caused by Corynebacterium diphtheriae. It was first described by Hippocrates in the 5th century BCE. Although once it used to take the lives of many children, the rates have gone down due to vaccination. There are still some cases in low-income areas. The common names for diphtheria is the children's plague and the strangling angel, due to the thick membrane it forms in the throat. The genus of diphtheria is Corynebacterium and the species is Diphtheriae. Its name comes from the Greek language and it means leather, referring to the thick membrane that forms in the throat. Corynebacterium diphtheriae is a gram-positive rod-shaped bacillus. The bacteria will stick to the lining of the airway and produce a toxin that damages respiratory cells. The most harmful strain of diphtheria produces an endotoxin called diphtheria toxin, which inhibits protein synthesis in host cells, leading to necrosis, which is the death of tissue due to injury, infection, or lack of blood. Diphtheria can be traced back all the way to ancient Egypt and Greece, but only recurring outbreaks date back to the 1700s. 1 in every 10 children who were infected died from diphtheria. It was not until the 1920s that treatment became widely available for the disease. Before then, diphtheria was seen as a death sentence. Diphtheria was first observed by Edwin Klebs and was first successfully isolated and cultured by Frederick Loeffler. The diphtheria vaccine was developed in the 1890s but was not widely used until the 1920s. During this time, medical scientists tried to make a safe and effective vaccine for the treatment of diphtheria. The antitoxin that was introduced in 1890 provided immunity for only 2 weeks. 6 years later, it came into general use, providing lifelong immunity. The antitoxin posed significant risk because it involved the injection of live toxin. The vaccine was then developed into the Tdap vaccine that is still used today. Corynebacterium diphtheria's major metabolic pathway is the iron-dependent metabolic regulation. Through this pathway, Corynebacterium diphtheriae is able to produce a toxin, which is what gives its virulence. Inside the host cells, free iron levels are extremely low. Corynebacterium diphtheriae will sense this through the regulator DTXR, or the diphtheria toxin repressor. When iron is scarce, the bacteria will turn on the diphtheria toxin gene, which leads to disease. Low levels of iron does not allow the DTXR gene to bind, so the toxin will be produced. The way in which Corynebacterium diphtheriae is able to capture iron is through siderophores, iron-transporting proteins, and through the uptake of heme and other iron-containing molecules. These allow the bacteria to survive in an iron-poor environment such as the throat. When there are low levels of iron present, the bacteria assumes it is inside a human host. The production of the toxin destroys the host cells, and iron is released as a consequence, which feeds the bacteria. This allows the bacteria to thrive in the upper respiratory tract, access essential nutrients, and increase its chances of survival and spread. The major virulence factor of diphtheria is the tox gene. The lysogenic bacteriophage will carry the tox gene and will infect the bacteria. The iron-regulated metabolic pathway will regulate the production of the tox gene. If there is low iron, the DTXR gene will become inactive and the tox gene will be expressed. If there are high levels of iron, the DTXR will become active, and the tox gene will not be expressed. Diphtheria uses pili and surface proteins to colonize the nose, throat, and skin, where it can be produced locally. The pseudomembrane is formed to protect the bacteria and allow it to reproduce itself. Diphtheria spreads from person to person through respiratory droplets. This can happen when a person coughs, sneezes, or breathes close to another person. The droplets will enter the nasal or throat mucosa. Diphtheria can also be spread through cutaneous contact. If a person has an open sore or ulcer and is infected with the disease and comes in contact with another person, they can spread the disease to the person without it. Diphtheria can be spread as well through contaminated objects, since bacteria can live on surfaces for short periods of time, although it is not common. Diphtheria has had resurging global outbreaks due to low vaccination rates, with a major increase of outbreaks in Europe among migrants and vulnerable groups. There has also been an increase in outbreaks in Africa due to weak healthcare systems and conflict. There are low vaccination rates due to COVID-19 disruptions and local immunity gaps. Vulnerable populations such as migrants, homeless people, and refugees are affected to a greater degree. Corynebacterium diphtheriae is also showing greater antimicrobial resistance, which makes treatment harder. Signs that someone has been infected with Corynebacterium diphtheriae are formation of a pseudomembrane around the throat, hoarseness, pain when swallowing, and signs of airway obstruction. If the pseudomembrane is observed, antitoxin treatment is started immediately, because waiting would be life-threatening. Some clinical tests that can be done for the diagnosis of Corynebacterium diphtheriae are a throat or nasal swab culture. Bacteria will be grown on a Loeffler medium or Tinsdale agar. The bacteria will form characteristic black or brown colonies on Telluroid agar. A PCR test can be done to see if the strain carries a toxin gene. Diphtheria is primarily prevented through the toxoid vaccines, which train the immune system to produce antibodies against the diphtheria toxin that causes damage to the cells of the respiratory system. Herd immunity is necessary to control the spread of diphtheria because it can easily spread in areas with low vaccination rates. Outbreaks occur in areas with low vaccination rates, which can be due to war, poor health infrastructure, or vaccine hesitancy. The initial treatment for diphtheria is the diphtheria antitoxin. The diphtheria antitoxin neutralizes the toxin found in the bloodstream. The diphtheria antitoxin should be given as early as possible to minimize the risk of heart and nerve damage. It does not reverse a toxin that has already entered the cells. Antibiotics may also be given to the patient with diphtheria. The antibiotics that may be given to the patient are erythromycin, penicillin G, and oral penicillin 5 or erythromycin for 14 days. Included on this slide are my references. Thank you for listening and have a good day.